Another live here with Rick Olderman. He has been on my show about, I want to say, a million times, because I'm not, probably 4 or 5 times at least. But
Yeah.
he provides from a physical therapy standpoint, connecting with chiropractic, how the nervous system actually works to connect to the body, to the mind, and to your sometimes emotions from a scientific perspective, which that's how I perceive it, to give you a perspective in his new book, How to Understand Your Body, Your Pains, and Correct It yourself with Rick, with your own physician if you want to, but understanding how that works. So that's my long topic. But the title of this interview is going to be: we want to fix our health, correct? We want to fix our pain, especially the chronic pain. People wait weeks to see a doctor. This is 2025. It's almost customary now. Like, you call your doctor, weeks, and I'll see you in about 3 or 4 weeks, give you some meds, maybe do some physical therapy, maybe some surgery. That, in most senses, does not give people relief. That's why we go see me, but that's why they see Rick. He's an expert in understanding the pain patterns causing chronic pain, and it will help you actually fix your pain through his book, through his knowledge, through his one-on-ones, what he does with his patients too. He explains all that is and more in his new book, Pain Patterns. I like this because this is our second interview on this, because he had just won 2025 National Indie Excellence Award in Alternative Medicine. Let's go through it, Rick, see what's going on. And first of all, let's get people back. People like, who's this Rick guy? How did you go from a physical therapist, business owner, teacher, now author of 9+ books, and now an award-winning author?
Yeah, Tony, it's a lot like you. When you see a need, you just try and fill it.
Have to.
And so that's what each of my books have been. It's been an evolution of me as a practitioner, seeing what my patients have needed, and therefore likely what everyone else has needed, and then writing about that. And then, the book's kind of this Pain Patterns book, I think is the best one, because it gives people a blueprint and a way of understanding their pain that I really, even though my previous books are like how to fix things, right? I don't really give you a way of really understanding what your particular problems are. I'm just kind of giving the exercises that fix most people. But in this book, the second half of this book is a workbook that allows people to test themselves and see where their deficits are. And in the book, I explain why and how those deficits play into their chronic pain. And so by the end of it, you have a real complete understanding of the bigger strokes of likely what other practitioners have been missing, and why you keep having this chronic pain.
You're giving someone, like us, we talked about a little earlier, the bird's eye view of what's going on and how the body actually works, that connect with them. So when they look for help, now they know what to ask, because now they know what they're feeling, because I tried this test, it's positive. Rick, what do I do next? And we'll go through that stuff, what chronic pain is and how that works, one too. And page 21, 19 to 21, I'll go through some of the book too, that I want to give people an idea of what I've seen in it from practitioner, and hopefully layman's terms too. Explain what is fascia and how it's different than muscle or ligaments or soft tissues of your body.
Okay, so fascia is one of the 3 components that I believe is causing or contributing to our patterns of chronic pain. The other 2 are movement patterns and also neurological reflex patterns. All right. So fascia is one of them. And what fascia is simply connective tissue in the body. And I was trying to think of, how can I explain this? And if anyone has ever watched Lord of the Rings, when you saw Frodo get caught up in Shelob's spider web, and he's just kind of hanging there, he can't move. Think of that spider web as fascia. It connects everything to everything in the body. And when you tug on one part, it makes other parts move too.
It's all connected, right?
It's all connected. And that's why it's called connective tissue.
Hey!
It's typically non-contractile. All right. And so what it's doing is it's holding everything in place and connecting things together. So if you yank on one cord, that's going to connect to another muscle or bone over here, or a blood vessel or nerve or organ or whatever. So if you were to move all organs, blood vessels, bones, muscles, and just left fascia in the body exposed, your body would look exactly the same as it does now. And that's how comprehensive fascia is, down to a cellular level, at least in terms of muscle cells, and then up to macro level in terms of sheets of fascia, like our IT band on the side of our hip or the plantar fascia on the bottom of our foot is a sheet of fascia. And so the body is organized, and this is based on Thomas Meyer's research. He's a fascial researcher and expert. He identified that there are superhighways of these connective tissue patterns running through our body. I identify 4 in the book that I think pertain most closely to chronic pain. And one of those patterns runs along the back side of the body from the head all the way down to the bottom of the foot. That's called the superficial back line. Then we have one that runs down the sides of the body. That's the lateral line, all the way from the head to the foot. And then we have a spiral line where it spirals through the body. That's the spiral line of fascia. And then we have a superficial front line of fascia down the front of the body. But then we also have a deep front line of fascia that runs deep through the deeper, closer to our spine, all the way up through our body. And so these 4 lines of fascia correspond to problematic movement patterns that have been identified in research, and also neurological reflex patterns. And so they're all reinforcing each other.
Perfect. It almost gives you a way to see why our body is so structured and so, if you want to call it organized, maybe from the bones, the organs, everything in the body, where it's really systematic how things work. And that fascia is that, like you said, the spider web that keeps it all together.
Well, you said systematic, and I absolutely agree. Yet we are not trained in systems thinking in medical school. All right. And this is where I feel the problem is in people and practitioners understanding the sources of people's chronic pain and why so many people fall through the cracks in traditional medical approaches is because we are trained to isolate and test tissues or a joint or a disc. That's what all of our testing is geared towards, to identify tissues that are damaged. But there are 0 tests that we are trained to do that identify why tissues are damaged. And if you don't solve the why behind the tissue damage, you can solve that tissue, but it'll just become redamaged a month later, a year later, or 10 years later down the road. And this is why chronic pain happens, is because we haven't identified those systemic causes that are causing damage to tissue.
It's almost someone says, I have a shoulder problem to their medical doctor, just the general medical doctor. Then you go, the shoulder's here. Let's put a shot at the shoulder. Let's medicate the shoulder, or let's just range of motion shoulder versus maybe connected to the elbow, the ribs, the upper back, the neck. Looking at the other areas, secondary, third areas that may be connected. That's what you mean by systemic, correct? That's what you mean by not focusing on the whole concept versus just the one area of symptoms.
Yes. And so, this brings up an important point, is that you and I are talking about chronic pain that has lasted more than 3 months, not acute pain. I think our medical system does really well with acute pain issues. That cortisone shot can solve a lot of problems. Isolating tissues for strengthening, stretching, and so forth from an acute injury standpoint is just what the doctor ordered to get you back on your feet. But what happens is that if you have problems that are lasting more than 3 months, which is the window where the body naturally heals itself in most tissues. If a bone breaks, it heals in 6 to 8 weeks. If you tear a muscle, 2 to 3 months to heal. If you cut your skin, 7 to 10 days to heal. So our body has these internal systems to heal itself. All of those internal systems work within a 3-month window. So if you're having pain after that 3-month window, something else is causing re-irritation or problems to that tissue. And usually it's a systemic issue problem rather than just a torn tissue or, a bone spur or something like that.
It brings a point to where connective tissue, going from that overall, how does that connect to now the nervous system relative than say other soft tissues or things in the body?
Yeah, so this is a great question. So, we talked about fascia a little while ago and how that is connective tissue. And so there is a certain type of fascia called myofibroblasts. Myo means muscle in medicine, And so myofibroblasts have up to 6 times the contractile capacity of regular fibroblasts. Fibroblasts are the cells that make up fascia. And so myofibroblasts are laid down in the body in areas of mechanical strain. One of the areas of mechanical strain in the body is the low back region, because the low back region represents a change in curve shape from a kyphosis curve in our upper thoracic spine to a lordotic curve in the lumbar spine, and then back to a kyphotic curve in the sacrum. And so when you change curve directions, where that curve is changing direction is automatically a stress point in the body. Before we add movement, muscles, or anything else, just a change in curve is stress. Now we add on top, if you look at the skeleton here, we have this large pelvis that functions as a unit. It abuts against the lowest lumbar vertebrae, which is, the pelvis is, I would say, 10 times larger than this tiny little vertebrae. So we have a natural stress point here as well, because when the pelvis moves, that vertebrae has to react to that pelvic movement in some way. All right. And so when it's not ideal, stress ensues. And so the body lays down more myofibroblasts in this region to help support this area of stress. This is why there is a higher concentration of myofibroblasts in the low back region than almost any other area in the body, even the bottom of the foot where we're walking on it all the time. So we have these myofibroblasts. The interesting thing is, and like I said, they have up to 6 times the contractile capacity. So myofibroblasts do not respond to nerve stimulation like our muscles do. So when we want to bend our elbow, our brain sends a muscle to our biceps muscles to contract, to bend the elbow. And then when we're done contracting, the brain says, okay, you can relax now, and the elbow straightens out again. Well, so we're using nerves to communicate to the muscles. Myofibroblasts do not communicate via nerves. They communicate through a hormone-like substance that floats through our bloodstream called a cytokine. This particular cytokine is transforming growth factor beta 1. This is released when our sympathetic nervous system is activated. The sympathetic nervous system is our fight or flight nervous system. So if we are stressed, if we are anxious, if we have undergone trauma of any kind, then it releases this transforming growth factor beta 1 cytokine that floats through the bloodstream and causes the myofibroblasts to contract. The difference between myofibroblasts contracting and muscles contracting is your brain can be telling your back muscles, okay, we're done. You can be quiet now. And they will be quiet. But the myofibroblasts, because of this potential longer anxiety or stress component, the sympathetic nervous system component, has a longer ramp up to contraction and a much longer tail to releasing that contraction. So as long as you are dealing with unresolved stress, tension, anxiety, trauma, if you're working a stressful situation, then you are constantly sending cytokines to those areas of myofibroblasts that you've created that then cause contraction to occur and tension in that area. When the myofibroblasts contract, they don't act on joints the same way muscles do. They're not going to move a joint. But what it will be like, Tony, is like if I were to push on your chest and lean into that as hard as I could, and you lean back against me as hard as you could, we're exerting stress against each other, and that will become painful at some point. That lower level type of stress, one that doesn't necessarily involve joint movement, is what's contributing to chronic back pain. And so this is why there's a lot of research, and especially in physical therapy, we're going to this cognitive behavioral therapy model, which is fine, because this is why cognitive behavioral therapy works. But we can't forget why those myofibroblasts are laid down in that area in the first place is because of some biomechanical impairment that's causing stress to be delivered to that area excessively and prolonged.
You're not talking about physical stress. You're talking about actually more emotional stress in the person's body, correct?
Well,
causing
the
that
emotional stress is triggering the
Okay.
myofibroblasts, but the
Okay.
myofibroblasts are laid down because of biomechanical stress.
Got it. Okay.
All right.
So,
So
someone who lives a normal life will have normal biomechanics and have a normal load. I want to call it location in their lower back, their feet, because that's the way the body's meant. But if you're under a psychological stress or whatever it might be, you might then activate those myofibroblasts because now they're more sensitive to that sympathetic system, which is your fight or flight, which is activated under stress, especially chronic stress. So you wake up with back pain.
exactly.
Got it.
And
Okay.
this plays into the neurological reflex patterns as well,
Mm-hmm.
and the movement patterns. So it's the movement patterns, which is the chapter before this,
Got
that
it.
that lays down the myofibroblast, the cause of the myofibroblast being laid down in the low back area or other areas of your body. So we have a movement bias that causes stress to our body. The fibroblasts are laid down in that area of mechanical stress. And then we have a neurological reflex patterns that reinforce the movement patterns and the fascial lines of stress as well.
And just to clarify in my head, the myofibroblasts are going to be in that location no matter what, but you're going to increase the amount of myofibroblasts based on your abnormal abnormal
Correct.
biomechanical stress, or I want to call it poor posture,
Absolutely.
or
Yeah.
overloading. You sit too much, you don't get up enough, blah blah blah.
Correct. And so let's say, I mean, other than the back, let's say you have shoulder blade dysfunction. Well, now you're going to probably lay down increased myofibroblasts in the shoulder complex or the neck. If you have hip dysfunction and you have gait problems that are causing hip dysfunction, then you have more myofibroblasts laid down in the hip area or the inner thighs. That's how it works.
You're going like, okay, then you're going almost a step back. You almost have to interview a patient. I'm thinking from an officer's perspective. Okay, what have you done in the past? What have you changed your stress areas? Have you changed jobs? Have you changed locations? Do you commute more? What are you doing or you had a previous injury in your shoulder maybe 10 years ago. Was it ever treated properly? And do you still have problems when you lift weights or at home? Okay, that in your head, you're almost going, are those more fibroblasts there? That's why when you're under stress, you feel that shoulder more.
Absolutely. So you can think of it in terms of myofibroblasts being laid down in that area, and or you can look at it as, if you understand how everything is linked together in the body, which is what this book is explaining, you can then start to say, oh, okay, so that knee is likely feeding that side bending problem, causing their one-sided back pain. And because that rib cage is down, now their scapula is down, creating a depressed scapula, which is now causing a neck issue. This is why this is how all this is linked together.
It's not looking at how it works. Of just the shoulder, the upper back, and look at the whole system of the body from head to toe of how it's going to affect the body.
Exactly. And you're absolutely right, Dr. Tony, is that, taking that history is critical. So my history, I mean, I annoy my patients because I make them go back so far into their history. But I also, if I sense some type of psychological trauma that has happened in their lives as well, I ask them about that as well, because of these concepts that we're talking about now. And these aren't just theoretical concepts. No. This is really how things are playing out in the body. So in many people, this is the key to fixing their chronic pain. And this is why, books like Dr. Sarno's book, I can't remember the title, Fix Your Back or something like that. He doesn't even go into an explanation of any reasons why it is. The whole book is just about how solving your mental issues solves your pain. Let's just solve your mental issues. Well, that works for a lot of people, but no matter what mental issue you have, if you also don't address the biomechanical issues, then that solution is going to be temporary. And you have to mix the movement with the mental.
It's exactly, instead of saying either or, just say both.
Exactly.
It's almost like, I was a second ago, it's almost like you're helping, and I did talk with someone yesterday. There is research, there is science, evidence-based, that your emotions, your mental state affects your body and vice versa. So it's not, we're not witch hunting here. We're making sure that you get the whole picture of your overall health getting better. not just one piece.
Yes. And I would say, Dr. Tony, probably 95% of my cases, 99%, I don't require a knowledge of someone's psychological distress,
No.
or trauma in the past. We can usually solve the mechanical issues, which are also contributing to the myofibroblasts being laid down in areas, and then that will solve the problem. But in few cases, the psychological stressors are critical to also solving the overall pain pattern that they're experiencing.
But it's almost, but you're taking, I want to step back and go realizing you're helping someone understand that's important for your health. Your
Yes,
physical and mental health is, and that alone will help them go, okay, that's important to me now. I want help. I want not help, but guidance in getting that better too. So my overall health improves so this doesn't happen again.
correct. And so when I start getting keyed into a potential psychological issue, is if I've identified the biomechanical problems in their body and we are fixing them,
Mm-hmm.
and that biomechanical pattern keeps coming back again and again,
Mm-hmm.
and I'm sensing a type of resistance to the treatment, that's when I start saying, just querying, hey, do you suffer from anxiety or anything like that? And most people will look up at me and they'll say, how did you know? And
Psychic.
their body is telling me, and that's what their body is trying to tell them, but they don't have the tools to interpret it at this point.
You're giving him the respect and the validity of saying that is important to your health. It's important to make sure the pain goes away completely and doesn't keep reoccurring back and forth.
Correct.
Yeah. All right. I mean, it's almost, you're helping someone. I want to say respect, but valuing their conditions, because they may not want to bring it up because it might be embarrassing, or if you want to call it, in their mind, even they've trivialized it as not a problem, even though it is. They just can't, their body's letting them know that it is a problem.
Correct. And so it's not only that they don't think it's a problem, they don't think it's a problem because of our medical training.
Mm-hmm.
All of our medical training is pointing to, oh, which tissue is it? Oh, you've got a disc issue. So this is why you're having pain, right? Or you've got this arthritic issue. This is why you're having pain. So our medical system is geared towards, and again, this works great for acute issues, but not great for chronic issues. But our medical system is geared towards identifying a tissue, not identifying a psychological issue that may be contributing to a stress pattern that they've never heard of before. So they've never even, most medical practitioners don't think of the body even in patterns. It's just a joint, or a muscle or something like that.
But when you go down the rabbit hole of helping someone get better, it almost like that, they appreciate that more than just going back and forth. I'll see you in 3 months for some more medication, or maybe we'll do physical therapy, or we'll do chiropractic next time if it doesn't get better. It's almost not giving someone a solution, just a chronic carousel of more and more treatments, and where their lifestyle, their normal is never get back to better normal, which would upset me.
You're absolutely correct. And so this is another subtle distinction that I feel like physical therapy is going towards, is more about treatments rather than solving pain.
Even chiropractic.
Why are those two things different?
Mm-hmm.
Because treatments, most physical therapy practices see treatments as another mechanism of getting money from the insurance company. Oh, well, we'll do some e-stim. I can bill $40 for that, and then we'll do some ultrasound. I can bill $50 for that, and then we'll do some dry needling. You'll have to pay cash for that one. That's $20 or $30 for that one. And then we'll do, whatever. And so that means that each of those treatments can be billed separately. Mm-hmm. And so they get reimbursed more. I understand the pressure for doing that. I used to own a clinic, and I had to sell it because I couldn't make money anymore based on not treating like that. I just couldn't go down that road. And so, people will feel temporarily better from receiving these treatments, but it's not solving the problem. And so I feel like we're getting further and further away from understanding and thinking from a problem, the system standpoint, and going more towards treatment of tissues. And if I mean, it's just not working, in my opinion.
You're not the only one either, too, Doc. It's almost like same thing with chiropractic. I get stuff every week sometimes. This new treatment, this new equipment, this new thing. You can charge this much for this equipment over here. Charge them cash for this. They'll pay for them. Like, you have body and mind and just the knowledge. Our job is really educate our patients first, and then give them what actually works for them, and then send them on their way.
Yeah, I'll tell you, Dr. Tony, when you start solving problems from a system standpoint, like what we've been talking about, chronic pain goes away very rapidly using this. You don't need to go again and again and again. So I just feel, I know, like I often shock my patients. They said, well, when do I expect to feel better? And I say, well, you should feel better right now or today. Yeah, it should be right now that you feel better. And the real question is, how long will that last? And the longer that lasts, it means the closer they are to using their bodies correctly. And the shorter that lasts, that means the more problems that we need to probably solve and try and get that to last longer and longer and longer. So that's how I interpret pain returning after treatment. And
that's all too. The change of physiology will take, you said, maybe 3 or 4 months or so your body stays in a different state. And now you know how to read your own body when you do have a pain here and pain there. But we want to teach you and teach your body, obviously, to calm down nervous system, get things to relax, get things better, so it knows what a better standard is for you, and then maintain that long enough so you know how to read your own body over time.
That's one of the reasons I was excited to put this workbook function in my book, is because people, when you'll actually write down your answers in the book. And so let's say, you solve your pain and 2 years later it comes back. You can do those same tests again, or look back at your results and say, oh, I forgot about that thing. Yeah, this is the thing I think that got me better. And so it makes it easier for you to solve it again, because we all fall back into bad habits, right? It's human nature. But having something that's permanent, that will show you exactly what you need to do every time that happens, will, make it less painful.
And everyone's body's different, correct? It's almost like we're all unique, but we all have unique injuries, biomechanics, stress levels, and things in our environment. But once you understand what that is, that's going to change. Those variables don't change very much. So why not understand it and put that down on paper so you can go back to your own notes, how I fixed, like you mentioned, how I fixed this last time. What did I do? And that point, you can actually not need us anymore, which is, I'm too busy as it is. At that point, you can actually get people to understand their own health and maintain on their own.
Yeah. One of the things I would always tell my patients is, I never want to see you again for this problem.
No.
And so what I want you to do, and towards the end of our treatment together, I always tell them, what do you think helped you the most? Name 3 things that you think helped you the most.
Good, I like that.
Please go write that down and put it on your computer. And next time this comes back again, revisit those 3 things and solve it yourself without coming in to see me.
Yes.
Works every time.
We almost, and like in our own education, we almost have to, even though someone may be a CPA, an attorney, law enforcement, firefighter, whatever it is, lineman, whatever, is they still have to learn beyond that how to take care of their own body. They shouldn't rely on a doctor to do everything for them, because that's why we're in this healthcare system problem in the first place.
Right. The problem is, it's like taking care of your own car. Well, how many of us really understand how a car functions, right? So we don't have a way to take care of our car because we don't understand the complexity of the car. And I feel that this book gives the broad strokes of how our body is functioning and how you can understand your body and take care of it forever.
Yeah, and you're giving someone that tool to really do I want to call it their own work, understand their own body, and then maintain that over time, over weeks, months, years, and even decades.
Yeah. So, earlier you had mentioned about, a patient, and there's a couple patient stories in the book that I talk about how I've used this information to solve their chronic pain. And one was a mother who had sciatic pain that became worse and worse with each pregnancy, and eventually it never went away.
Yeah.
We solved that within 2 or 3 weeks, I think. And then there was this other guy with 20 years of back pain.
Yeah, surgery, correct?
He had surgery. He had everything. And, within a couple of weeks, I think he was 75% better. And within another week or two, he was 100% better. And we had lunch a few months ago, and he says, I don't understand it. I have no back pain. I'm doing skiing, I'm golfing, I'm doing everything I want to do. And I'm not doing any of your exercises that you gave me to do to solve my back pain. Why is my back pain gone? And I really, truly believe if people get the book and read that story, he was going through a lot of psychological struggle at that time with his family. And so he was a big CEO kind of person, couldn't really talk to other people about it. But he could talk to me because we were working with his body. And so I have a technique that I use called somatics, which I talk about in the book, to help release tension, these tension patterns in the body. It's very effective. And so while we were doing this, we would talk about his family issues that were going on. It was him doing most of the talking. I would just listen while I was,
that's being good doc. That's being good physician. There you go.
Yeah. And so I truly believe the reason his back pain is permanently gone is because we not only address the physical problems causing his back pain, but this goes back to the myofibroblasts. I believe we release the psychological triggers that were causing his myofibroblasts to excessively contract in his low back area, while also releasing the mechanical expression of that psychological issue. And so working that out with him week after week while he's talking about this stuff. And this wasn't my plan. I didn't know this was happening at the time. I was just listening, and just being a good friend. And so, but it was only after he said that this has lasted for 20, I haven't seen him now for 8 years maybe. And he's just like, I don't understand it. So this is me just finally putting all this together. Why is he feeling better without doing any of my exercises? Oh, it must have been because we solved his psychological stressor manifesting in his body.
And going from that story too, I looked at some of it too. What are somatic exercises you're talking about as a way to help someone get through their stress points?
Yeah. So somatics. So the meat of somatics is about resetting elements of our nervous system. Okay. And in particular, somatics targets the muscle spindles in muscles. Okay. And I don't want to get too technical about it. We can if you want to, but most people probably aren't interested.
Thanks, Rick. But I've never talked about.
Yeah,
we would, but they have no idea.
Yeah, but anyway, there are things in our muscles called, and they are mechanoreceptors that monitor length and tension of our muscles. And in chronic stress, these and in chronic biomechanical problems, where we're using our body incorrectly, these mechanoreceptors get ratcheted up and overly active, and they set a tension length pattern in our muscles to be excessive. And so all somatics does, it's a method of contracting and slowly releasing to reset those mechanoreceptors. So the interesting thing is it's different than stretching because this involves the brain releasing the tension that those mechanoreceptors are holding, rather than you just passively stretching something without brain involvement. The contraction and slow release helps the brain monitor the tension and release it as well. So we're resetting the muscle spindle threshold when we are doing somatics. Hopefully that's not too technical.
Well, how it interpret is basically someone that doesn't know they're under tension, tightness, maybe wherever in the body. Now you're helping the brain to see that as that is under tension, but release it, and then at that point keep it released, because now we know a new normal where it should be versus where it was before at a high tension amount.
Exactly.
Tightness, for some people understand more tightness and tension.
by bringing the brain into it and having the brain assist with resetting this, it makes the change more permanent.
Perfect.
So this is what I found in the Hanasomatics training that I did. They didn't address biomechanics. They only addressed neurological tension patterns.
Okay.
And so anytime I would talk to them about biomechanics, they're, no, that's not what we're doing. This is it. So this is why I think this book is a nice blend of, and Hanasomatics is like the jelly of my peanut butter and jelly treatment sandwich, because it's so powerful for chronic pain issues. And that's why I've included access to 3 Hanasomatics lessons, audio lessons in the workbook, so people can experience what their body feels like when it is more relaxed from a neurological standpoint with their brain involved. It's really a unique thing.
What's the first, you said somatics, what's the first word you said on for somatics?
Hanna.
Hanna, okay.
Hanna. So that's from Dr. Thomas Hanna, was the developer of Hanasomatics. And the story goes that he's the one who brought Moshe Feldenkrais to the United States because he discovered his information and brought him to the United States, and he studied under Moshe Feldenkrais. And what he learned was he felt that Feldenkrais was missing the intentional component of lengthening and resetting these neurological mechanoreceptors. And so he developed Hanasomatics. It's much different than somatics is like ubiquitous now. Everyone talks about somatics. Everyone's a somatics practitioner, but there's only one type of somatics that I've studied and looked at that involves the brain and deep understanding of this neurological patterning, and that's Hanasomatics. It's much different than any other real somatics.
And you're giving someone through Hanasomatics a way to, and just to summarize from in my own brain, a way for their brain to understand when their body is under tension, and obviously releasing tension first, but then resetting it so now they know what a new normal should be and maintain that over time through you said more of the training, more I guess retraining or resetting your tension levels through somatics training over time. Is that correct?
Yeah. So part of that retraining comes from understanding why your body is stressed biomechanically. Okay. And so that's what all of those tests are for in the book, is to understand those sources of biomechanical tension development. But also, Dr. Tony, it's about understanding and being aware of your tension, right? And so so many of us go through life unconsciously, or we have old psychological stressors or traumas, or we have current anxiety, all sorts of things. We're not aware of the tension that's felt in our body. Well, the nice thing is when you do a Hanasomatics lesson, it kind of resets all of that from a body standpoint.
Good.
And so you get up and you feel like this fluidity that you may never remember have felt before. And you're just like, oh my gosh, this feels amazing. I didn't know I could feel like this. And so what I would always tell people after our somatic sessions is just now pay attention to how long that lasts.
Got it.
Start noticing when your body stops feeling like this. And then you'll start to then ask yourself, why is that happening? And so it's either happening from a biomechanical reason, because you're using your body incorrectly, or from psychological distress, or both.
Yeah. Okay. And then you said there's certain exercises you can do or sounds you can listen to kind of to maintain that, I guess, that training or the exercise on a daily basis, or when you feel that tension come back?
Well, that would be those somatics lessons.
Yeah.
So you would just revisit those and do them whenever as needed.
Okay.
I am putting 2 longer back pain. So those are audio lessons in the book that people will have. So I'm putting 2 video Hanasomatics lessons on my YouTube channel. Those will be coming up, I think, in late July or August, sometime around there.
Let me know. I want to add to the show notes and online and kind of revisit that, because I think people need a way to reset their body and mind on a daily basis sometimes based on their stress level. So tomorrow's better.
Yeah.
You know what I mean?
So an easy way. Yeah. And so I mean, we could do a somatics right now, Dr. Tony. Just simply, if you just arch your back, and those of you at home, if you're sitting or standing, just arch your back and come into this hyper, arched position, and you'll feel all of your back muscles engaging. And now all you do is just simply slowly lower that, reduce that arch, and let yourself slump as much as you feel comfortable going. Just keep going if you want to. There's no right or wrong. And so that is a somatics protocol right there. Perfect. So you're contracting, and your brain is controlling the lengthening and release of those muscles, Perfect. Which is then resetting the muscle spindles involved with that tension pattern. Different than the myofibroblasts.
It's getting someone, I think, through your book to really understanding how to fix their pain, and then through somatic lessons and other things. We talked about I saw your breathing box technique in there too.
Yeah.
A lot of it is getting someone a way to maintain that better health, and so the pain doesn't come back. Or if it does slightly come back and give you a hint of that, let's get that out of there real quick.
You're absolutely right. So there's more than one way to skin the cat, and what works for one person may not work for another. So I just offer other examples in the book of ways to reduce your sympathetic nervous system output, so that at least we can lower the cytokine production that may be stimulating your myofibroblasts. But don't forget, you have to also understand the biomechanical problems of your body that are contributing to the myofibroblast formation in the first place. That's what a lot of the tests in the book are about.
And talk about the common biomechanical issues people deal with that are leading to the downfall of the whole body kind of going into chaos.
Yeah, the primary one, Dr. Tony, is something that we all do every day, and that is walk.
Got it. Okay.
That is where most of the problems are manifesting through a gait pattern of some sort.
Got it.
The most common fault that people make when they're walking is that they lock their knees. And so what this does is it turns off the ever important butt muscles. And if you just look at the size and the architecture of the butt muscle, it is made for constant hard work.
Load.
And by locking your knees, so it has many functions for the pelvis, controlling the thigh bone rotation, controlling lumbar mechanics, so forth, even the foot. So when that shuts off, you've lost your center of control of basically your entire body. And it's getting turned off because of most people are locking their knees. Why are they locking their knees? Because they're doing more of a heel strike pattern when they're walking. Rather, they're allowing their foot to go forward without them. And I'll demonstrate. It's really easy.
Good.
So most people walk with their foot coming forward like this, and then they come forward. All right. This turns off the butt muscle. So what they should be doing is allowing the body to advance with the foot instead.
Good. Okay.
When the body advances with the foot, the knee naturally unlocks. It's hard to lock the knee like this. It feels really awkward. The knee naturally locks, and then the butt naturally turns on.
Perfect.
That simple adjustment in gait solves a lot of chronic foot, knee, hip, and back pain. SI joint pain too. Because you're turning on the butt, the primary controller of thigh bone rotation, pelvic orientation, lumbar mechanics, and foot orientation.
It's amazing. I do it with my patients too. When I see things are just overall off, maybe upper back, low back, hips, everything just seems biomechanically off. Muscle tightness in the right place, muscle weakness in the wrong place, foot issues for 1, 2, foot turning in or out for 1 also. I go, let me see you walk. How do you walk? And I go, let's fix that so everything else feels better, and you're having pain you have now, over time go away.
Yeah. I've got a couple of videos coming up on my YouTube channel where I show people's walking patterns and show where the problems are. And then I have this series I put up. You'd have to look back in them, but it's called Airport Walking.
Okay.
Where I surreptitiously took video of people walking in an airport.
Stalker.
And I commented on, what the problems are,
Yeah.
And once you see it, you can't unsee it. It's so obvious. Once you know what to look for, it's simple. I don't have any gift of seeing
Yeah.
gait patterns, right? It's just because I've paid attention. And if you watch those videos, and I make it very clear what those problems are. And so anyway, if you're interested in understanding your gait pattern, and frankly, if you're having chronic pain or any kind of chronic back,
Good.
hip, whatever, gait is a central component of you being permanently fixed.
Mhm.
And so I would check out those videos. It's very simple to fix gait.
And it's all it is. Really, it's when you break it down, the foundationals of how we sit, how we stand, how we walk. Those are things that affect us all day long. To realize that may cause back pain 3 months later, 2 months later, a
Exactly.
week later for one too, and then reoccurring if you don't fix those three things first.
Yeah. So I've applied to be a TED Talk presenter,
Yeah. Got it.
but
Okay.
but no one wants me to talk yet, I guess.
Not that
But
famous
anyway,
yet, Doc. I mean, you'll get there eventually,
yeah.
but give yourself some time.
So anyway, I've been practicing my speech, but on it I have a video where I show some of these airport walking, and I show how dysfunctional people's walking patterns are, and they are completely unaware of it, clearly, or else they would have fixed it, right? But what's one of the most common things that most healthcare providers say, a doctor, PT, I don't know about chiropractic, but they'll say, you know, if you have back pain, you should start a walking program. That'll help you.
But
Well, what if you're walking incorrectly?
yeah,
And most people are.
yes.
So the walking program isn't going to solve it. It will likely even deepen the problem.
That's okay with me. Job security. I want more people.
I know, but this is it's almost maddening to me. It's just like, no, we have to fix the walk before they walk more. No, and I don't blame, you can't blame them because we're not trained to think of things like
They're
this.
naive. They just don't know.
Well, yeah, I mean, I've treated lots of doctors, and they're always just like, gosh, we only had like maybe a couple weeks of muscle anatomy, and bone. We're not trained like you guys
We
are.
refer people up. We refer them over there. Yeah, we don't.
Yeah, so it's just like so you can't, even though they have doctor after their name, that's not their specialty. They're not trained in the musculoskeletal system, and so listening to a doctor tell you what to do about back pain will only be really broad sweeps of information. It won't be anything specific for your particular issue.
Especially with chronic pain, correct? It's almost like you said.
Correct.
Comes in, they had in a bad accident, they fell off a roof, whatever. Okay, let's get this contusion calmed down. The fluid calmed down. Is a broken bone. Let's get everything reset. Boom, good. We talk about 3 months later. Why is the pain not going away?
Correct. And likely they had movement habit problems before they fell. The fall was just the straw that breaks the camel's back, so to speak.
Yeah. And getting to the end of the show too, anything I missed you want to bring up from your book? We covered a lot of there's a lot of mechanics, and there's a lot of how to stretch. That's given. But I want people, like you said, to understand is why is the book there for you? How do you get the book become part of your life so you know how to go back into it and make you understand your body, how your body works?
Yeah, I could guarantee if you go through the workbook section, and it's only like 6 tests, maybe something like that. It's not very many, but I can guarantee you've probably never done those tests before, and you will find problems in your body doing those tests. And if you solve those problems, likely it will solve your pain. So that they're very. I've been doing a lot of telehealth these past few years.
Yeah.
And so it's helped me distill my my testing down to just a few tests to see where the big picture problems are. And that's where most people aren't missing the little picture problems. They're missing the big picture problems. And so these tests will help them do that. And so the other thing I wanted to mention is that, all the exercises and tests in this book are found as videos on my website.
Good.
So, a lot of people like videos rather than just pictures. And then lastly, you brought up the 3 pillars of pain thing before in an email to me. So we've talked about a couple of these pillars. So I believe my overall theory of chronic pain is that there are 3 things that push most people into chronic pain. One are biomechanical problems. The other are psychological or emotional problems. We've talked about both of those today. The one that we didn't talk about was dietary or allergen or mold, things that we ingest problems, because that can cause an inflammatory response in the body that then magnifies the problems that we've been talking about today. So, and some people are 100% biomechanical. Some people are 100% psychological. Some people are 100% dietary and are perfect biomechanically. So everyone, because of our history,
Rick. No one's perfect.
Yeah, because of our history, genetics, and so forth, and upbringing, work, all sorts of things, exercise habits or non-habits, that we all have a unique, component of how much of each of these pillars is causing our pain. So I am not a dietary expert, but I'll offer in the book, some information about that. If you wanted to think about the dietary components, and I give you a way to go through your pain through a questionnaire and kind of maybe identify if there is a psychological or dietary issue or something like that that may be contributing to your pain that maybe no one has really addressed before. So I've tried to make it as comprehensive yet succinct as possible.
It's almost like you said, telehealth helped you and just your overall being with patients as long as you have been, the experience to go, what can I narrow it down to give people an idea of how to look at their own health for themselves and then figure out what they need, maybe, like you said, all three pillars, mechanical, psychological, even dietary also. What can they help kind of fine tune their health so that point they get better and better over time?
Yeah, exactly.
Good. What do you want? What's a good takeaway, Rick, for people to look and see and use your book?
I think
book for. That's my big.
The book is for anyone who has chronic pain or is frustrated or tired of getting treated on a weekly basis for months or years. And even though it may be helping you, something is missing. You shouldn't need to be treated for months or years to solve pain, chronic pain. Yeah. So it's for those people, and there are a lot of them. So because we have massive cracks in our medical system that people fall through. And what I have learned is that I was listening to two doctors comment, and one doctor was a researcher, and he did a research project, and he said, and I did this intervention, and 75% of the people felt better. And they were just like, yay, Pat, all right. And I'm just like, well, what about that other 25%? Yeah. And that's what people tend to ignore, is that other 25%. And that 25% is what's driven me to understand this information and write all these books, because I didn't ignore those 25% of people that I wasn't getting better. If someone wasn't getting better, I had to figure out why, because my job as a physical therapist is to get people better. How can I ignore these people? It has to do with me. It's something I've missed. It's not their fault. So, it is their fault, but it's my fault for not figuring it out. So it's almost looking at someone as you want them better no matter what.
Exactly. You want to make sure they get the improvement they expect as a human per se. No, it may for me, same thing. If I find someone that's not getting better, what am I missing? Where can I get more help? Do I need an MRI? Do I need something else that I'm missing that I need to look at to help them improve their health? I treat like you do too. Every patient is a family member I actually like. I want them to get better because I want them to see them in the future getting better for their family, for their future generations, so they improve, so they feel like they're worth something. How many people are that we've heard of are on medications for a lifetime almost, and their life just dwindles down, where they become part of that 10% where people don't want to talk about. Mm-hmm. Yeah. I don't want people to do that. I want people another option where they can see the improvement no matter what.
Yeah. So. And I'm not great at marketing. So that's why I write books, is because it's a way for me to get that information out there for people to stumble upon. And, because people, if you have chronic pain, it's a great motivator for figuring it out, you
Mm-hmm.
know?
Mm-hmm.
And so I'm trying to, put out things that, people can find somehow.
I had an interview yesterday with someone who's writing books also, a different subject, but it's almost like you can help more people that way versus trying to see someone one-on-one, to get them involved.
Yeah.
And then they come to you because they want your help.
Yeah.
It's more of it's being there when they're ready for you, relative to trying to help everybody at one time, and I'll call wasting energy, but not as efficient.
Yeah. It's like, what's that old saying? When the student is ready, the teacher will come, kind of thing. And
Yeah,
so,
little kung fu saying, I think, whatever it was.
yeah. So these books are little teachers out there.
And we have we have links to the book in our show notes today too, along with our first interview we did a couple months ago. But other stuff too, he has website on there for one, how to get his books, how to contact Rick personally through even his social media, through YouTube, and see his videos. If you learn through video like I do, at that point, watch his videos, and will that help me? We have to do our own research as people, as each person, to get our own help, because it's hard to just trust our doctor with everything that they give us all the time.
And speaking of the videos, I did a whole series on the Pain Patterns book. So I did a video for each chapter on YouTube. So people can, go through the whole book and watch the videos. And I even have the tests on there, I think, in most of them. So they can do that without even buying the book and seeing if that information seems to resonate with them, if they're finding problems.
But Rick, how are we going to help you afford your mansion you want to buy if we don't buy your book?
Yeah.
What the heck?
Yeah. Good point. Just edit that out.
Yeah, sorry. I think at this point we just live simple lives. It's like we just want to help people. Yeah. It's like, what else is there to do?
I'm so happy to help people. It just makes me feel whole.
Yeah, that's why we do this. Thank you, my friend. I'm gonna end the show. We'll talk in the back room. Thank you guys for watching. Hope this helped you, and we'll see you on the other side.